Hello, I'm Dr. Leong. Today I shall be talking about COVID-19, some quick facts. Today I shall be talking about home quarantine, vaccines available in Malaysia, and the National Recovery Plan, and how to stay safe. A suspected case of COVID-19 needs to fulfill two criteria. One is the clinical criteria, plus an epidemiological criteria. The clinical criteria is either acute fever and cough, or acute with two or more of the following symptoms: fever, cough, general weakness, fatigue, headache, myalgia, sore throat, running nose, difficulty breathing, anorexia, feel like vomiting, and vomiting, diarrhea, or altered mental status. The epidemiological criteria has to be within 14 days prior to the symptoms and signs. It can either be a stay or work in an area of high transmission, or stay or travel in area with community transmission, or work in any healthcare setting. A case is confirmed positive when the RTK antigen test is positive in an area of prevalence greater than 10%, or a positive molecular test, either RT-PCR or a rapid molecular test. Here is a chart showing the probability of detecting SARS-CoV-2 using the RT-PCR test. Probability of detection, the weeks since infection, and the time of presentation of symptoms. The incubation period of COVID-19 is usually 5 days, and most patients will present with COVID symptoms within 11 to 12 days. At the presentation of symptoms, the PCR test is usually positive because of viral shedding, which is at its peak. However, if the test is negative, one can repeat it 2 to 3 days later. As you can see from this graph, before symptoms present, the PCR test may be positive, signifying that the person is already shedding virus into the environment and the person is infective. 10 to 14 days after presentation of symptoms, the virus can still be detectable but may not be viable, and culture may be negative then. Here you can see the rise in antibody, IgG and IgM, peaking at around the end of week 2 or the beginning of week 3. The SARS-CoV-2 virus has mutated, and there are various variants. We are concerned about the variants of concern, like the Alpha variant, first detected in the UK, the Beta variant, first detected in South Africa, the Gamma variant, detected first in Brazil, and the Delta variant, first detected in India. There's evidence that this Delta variant is more transmissible and also reduces the neutralization effect of antibodies produced by vaccination. On 10th June 2021, the Malay Mail reported that Dr. Noor Hisham stated the presence of variants of concern in Malaysia. The variants of concern include the Beta variant, the Delta variant, and the Alpha variant, whereas the variants of interest include the Theta variant, the Eta variant, and the Kappa variant. We shall now talk a little about home quarantine. Clinically, COVID-19 can be divided into 5 categories. Category 1, the person is asymptomatic. Category 2, the person is symptomatic but has no pneumonia. In Category 3, the person is symptomatic with pneumonia. And in Category 4, symptomatic with pneumonia requiring oxygen supplementation. And Category 5, the person is critically ill with multi-organ involvement. Category 2 can be divided into patients with mild symptoms and patients with moderate symptoms. The mild symptoms we have discussed in our earlier slide, and patients in category 2 have red flag symptoms, which include 1. Persistent or new onset fever, difficulty breathing, which is getting worse, chest pain, unable to take orally, worsening lethargy, like struggling to get out of bed, unable to ambulate without assistance, worsening or persistent symptoms such as cough, nausea, vomiting or diarrhea, reduced level of consciousness, and reduced urine output in the last 24 hours. Confirmed COVID-19 cases. Those in category 1 and 2 with mild symptoms can undergo home quarantine. Those in category 2 with moderate symptoms and category 3, 4, and 5 should undergo hospital admission. Patients who are going for home quarantine should be less than 40 years old, without comorbidities like diabetes, cardiovascular disease, chronic lung disease like asthma, COPD, chronic kidney disease, hypertension, or obesity. They must be able to ambulate without assistance and be able to self-medicate. There should not be any ongoing clinical needs like hemodialysis. They should not be pregnant and must not be immunocompromised. The home conditions should be suitable, and the person must adhere strictly to SOP. The caregiver should be not more than 60 years old, should not be pregnant, should not have comorbidities, must not be immunocompromised, or have other illnesses considered at high risk for infection. The home condition, there must be a telephone available at all times. There must be a separate bedroom or isolation area with attached bathroom preferably. The occupants in the house are not immunocompromised. And the caregiver must be present. The person must be able to stay at home, maintain physical distance from other household members, and not to allow visitors. The person must have basic preventive measures like wearing masks, regular hand washing, and practicing cough etiquette. The person must be able to report daily to the healthcare authorities through My Sejahtera app or via phone. And the utensils and tableware should be for exclusive use of the person. I shall now talk about vaccination. National COVID-19 Immunization Programme is on a voluntary basis. It's free for all Malaysians and non-Malaysians residing in the country, group 18 years and above, and the DCA on 15 June has approved the use of Pfizer vaccine for those aged 12 years and above. The target is 80% of the Malaysian population and to be completed roughly towards the end of the year. We are now in phase 3. Phase 1 for frontliners, phase 2 for high-risk groups and disabled, and right now phase 3 for the remaining adults. Portfolio of vaccines in Malaysia. We have vaccines from manufacturers like AstraZeneca, Janssen from Johnson & Johnson, Novavax from Pfizer, BioNTech, AstraZeneca, as we mentioned, Sinovac, Biotech, CanSino Biologics, and also the Gamaleya Sputnik 5 vaccine. As you can see, the most is from manufacturer Pfizer, BioNTech, which will cover about 70% of the population. The portfolio of vaccines in Malaysia are from manufacturers who use different technologies to produce the vaccines. The mRNA vaccine technology is used by Pfizer BioNTech, viral vector technology by Oxford AstraZeneca, Janssen, CanSino Biologics, the Gamaleya Research Institute, and the whole virus, the Sinovac Biotech, and the protein subunit by Novavax. As you can see, as of mid-June, 60% of the population have registered for vaccination. Around in May, there has been an accelerated demand for vaccines. This is a chart showing the vaccination targets for various states. Several states like in Selangor, Sarawak, Kuala Lumpur, and Putrajaya will complete their vaccination somewhere in August. Labuan is the earliest to complete somewhere in July, whereas in Perak, the completion should be somewhere around at the end of the year, with mid-term vaccination target completing somewhere in September. Adverse events with mRNA vaccine. Heart inflammation, myocarditis, and pericarditis occurs within several days of vaccination, usually following the second dose. It occurs mainly in males, adolescents, and young adults greater than 16 years old, and they present with chest pain, difficulty breathing, and palpitation. The mRNA vaccines are from Pfizer and Moderna, and the incidence is somewhere like 2 per 100,000 aged between 16 to 39 for the Moderna vaccine. Adverse events from viral vector vaccines. Thrombosis with thrombocytopenia syndrome, TTS in short, occurs within 3 to 30 days post-vaccination. Of note is cerebral venous sinus thrombosis, CVST, which usually presents with severe headache, worse when lying down or bending over, blurred vision, nausea and vomiting, difficulty with speech, weakness, drowsiness, or even seizures. These are all the cerebral symptoms. It can also occur with unexplained bruising or bleeding. The person can also present with shortness of breath, chest pain, leg swelling, or persistent abdominal pain from thrombosis. This is an immune syndrome. It occurs in the AstraZeneca product, 4 per million doses. Janssen vaccines, 2 per million doses of the vaccine. The National Recovery Plan. The National Recovery Plan has 4 phases: Phase 1, Phase 2, Phase 3, and Phase 4. There are conditions to be met in every phase, and they are the daily number of cases, ICU utilization, and the percent of the population vaccinated. During each phase, certain things are allowed. In Phase 1, essential services are allowed. In Phase 2, some economic sectors to reopen, social sectors remain closed. In Phase 3, more economic sectors to reopen, social sector reopen gradually, parliament and schools to reopen, and in Phase 4, full reopening of the economy. This is a chart showing the observed and forecast cases between April and June. R0 is the basic reproduction number of an infection. The rate of infection rises when the R naught is greater than 1. Like in here, 1.2. The projection is rising cases, and declines when R naught is less than 1. When the R naught is 0.9, they are reducing cases. Right now in Malaysia, we have this scenario where the R naught is less than 1. Hospitals and facilities. Over the last couple of months, the country has increased the number of hospitals managing COVID cases, increased the number of ICU beds, and also increased the number of ventilators available to treat the patients. This chart shows the number of people vaccinated in different countries. In Malaysia, we have more than 10% of the population being vaccinated. This is phase 1 of the National Recovery Plan, the target for the phase 2 of the National Recovery Plan, and phase 3 of the National Recovery Plan. Prevention. Virus transmission occurs commonly via droplets like coughing, sneezing. These are particle size 5 to 10 micron. It also occurs via surfaces through infected fomites, and of course airborne transmission of particle size less than 5 micron, especially during aerolizing procedures, and these particles stay in the air for hours. There has been no reported cases of fecal-oral transmission. Virus particles. It has been mentioned that the infectious dose is about 1,000 virus particles. When we breathe, we can expel about 20 virus particles per minute. When we speak, about 200 virus particles per minute. And a single cough can bring out 200 million virus particles. And these may remain in the air for hours in a poorly ventilated environment. And a sneeze can also bring out 200 million virus particles. The infectious dose will then be the sum total of virus particles times time. So the virus will be shed during different stages of the illness, more abundant during the time of fever, and it also depends on the virus transmissibility. And activity like coughing, sneezing, talking, singing, walking or running, because then these will bring out different number of viruses. The mask type one is wearing, the presence of face shield to protect the eyes, the maintenance of social distance of more than 6 feet, the ventilation of the place, and the people density, as some may be infected with the virus. How to stay safe? First, get vaccinated. The benefits of vaccination outweighs the risk, and the risk is minimal. Wear mask, double mask if possible, N95 in proper settings. Maintain social distancing of more than 6 feet. Practice frequent hand sanitization. Reduce the duration of contact with all people, as we do not know whether they are carrying the virus. Go to places where there are fewer people. Choose locations where there are no reported cases. And when in places or in rooms or in closed rooms, make sure the ventilation is good. Be aware of the emergence of variants of concern, where the virus is highly transmissible and has reduced neutralization. Thank you for your kind attention.